So today we're talking about temporomandibular joint dysfunction, also known as TMJD. And there is a strong correlation between having jaw issues and having neck issues. So much so that a lot of patients that have tension type headaches also have jaw problems. There is a connection. And let me explain this in a way that'll make a lot of sense. So if I were to open my jaw, no issues, and I don't have any TMJ problems. Now if I were to put my neck forward and open, I get some tension. And so you can do that on yourself, and it'll help you understand that neck dysfunction or postural problems can contribute to TMJ as well as stress. So there are a group of muscles on either side of the jaw that are responsible for TMJ problems. And so I'm going to go over those now. So the number one that we see most issues in is the masseter and the buccinator, which is right here. So you can kind of go in there and see if you have any pain or tenderness. And so you can massage those out. You can just press, open, press, open, press, open, and work the whole tissue. You can also put a little bit of massage cream lotion and go up, down, left, right to loosen this up as well. Be careful, it's a very tender area, so just take it easy. The next one would be right at the TMJ joint right here. So the lateral pterygoid connects right here. And I actually have a little bit of tenderness right there. So I can pin that muscle and open like that. I can also do some massage work. Another common one is going to be the posterior digastric, which is underneath right here. And on me, that's a little tender. And then there's an anterior digastric, which is up underneath here. That one has a little bit of tenderness too. So you can massage those by going forwards and backwards. You can open the jaw, you can close the jaw while you do it. Another area that we see issues is inside the mouth. So inside the mouth, up here by the molars, there is the medial pterygoid. And you can stick your finger in there, get right next to these molars in between your gums right here, and kind of twist, and you may find some tenderness there. You can work that one out as well. Now there are a couple other ones that are less common that we see in practice. The temporalis area right here can be very tender, and then also the temporalis muscle itself. I don't find those as much, but if you do feel some in there, you can just grab and open. Grab, open like that. So check both sides of the jaw and work out whatever muscles are tender, and then I'm going to give you a couple of stretches that work really well. These are isometric, so you're just going to do a little bit of resistance with them. And so the first one will be to open your jaw really wide, and then you're going to press into the hand. So I'm going to open wide like that. So when I'm opening, I'm pressing to the right, and I'm giving a little bit of resistance with this hand, and that's to fire these muscles, stretch them, and then teach them how to work appropriately. So you do it on the other side. And the other one I like is you open really wide, you put your fingers right on top of your teeth, and then you're going to very carefully put some pressure upwards, and then when you relax it, you're going to pull down to stretch a little bit more. And so with those stretches and those massage techniques, you should be able to improve the TMJ dysfunction that you have. If you're struggling with this or have any questions, feel free to ask, and please subscribe for future videos on other topics that may be useful for your health and wellness.